time here. I'm making some presentation around the actions of youth for implementing National Action Plan, or the roles that youth, rather, a role that youth can play in the implementation of the National Action Plan for Antimicrobial Resistance. So I thought to give some sort of a highlight. Emmanuel Benyeogor, trained as an epidemiologist, and I work with the Nigeria Center for Disease Control. But I'm currently out on study at the University of Nagasaki. And Nigeria's Center for Disease is the National Public Health Institute, and we currently have the mandate to prevent, detect, and control spread of communicable diseases. And you would see that surveillance is part of what we have there. And just talking about communicable diseases, I'm sure some of us would be asking, is antimicrobial resistance communicable? So I'm hoping that by the end of the sessions, maybe we would have a different view about this. This is basically the history of NCDC. I won't dive much deep into it, but the highlight here is just to show that it was made up of a couple of departments and program from the Ministry of Health. And it was in 2018 that we got the act signed into law by the president. I also thought to show this. In Africa, we have about 33 countries that currently have a national action plan on antimicrobial resistance. And this is out of the about 54 countries in Africa, but that the WHO Afro region has only 33 countries with an action plan in National Action Plan for Antimicrobial Resistance. And this is very important because the National Action Plan for Antimicrobial Resistance actually is more like some sort of a metric that sets the pace or determines what is going to be done or who is going to do what. Okay. And yeah, Nigeria has one, and ours is slated for 2017 to 2022. I think work is currently on with regards to a new strategy. So perhaps we have an understanding. Wasn't sure who we have on the call, but this is just for some sort of a reminder. So if it's a reminder to us if we are already into antimicrobial resistance, or this is the first time we're engaging it, because we always have different groups that are looking into how to support antimicrobial resistance. But we know how very early, with regards to the development, or how we actually stumbled upon antimicrobials. And just this, what the picture you have there is a molds from bread, or on the bread that has been left for a while. And just to say that the earliest civilization used mold and plant extracts as antimicrobial. So you would have someone take some sort of extracts from this and used to treat infections back in the days. And in Africa, we used bread molds to treat infections in wounds. Also, how Alexander Fleming discovered penicillin in 1928 and beta-lactams, and you'd see that one of the challenges we have today is that post 1928, most of these drugs are now, not that they are no longer working, but that if you have some drug that is working, the microorganisms that the drug is supposed to kill is not dying from the effect of the drug. And that's really how we say, that's really the sum up of antimicrobial resistance. So it was in 1914 that there was a first indication. So you can see that just 12 years, 12 years after it was discovered, there's already a report of resistance. So you can imagine what we have like now, and the list is endless. So what is global threat? What's the current situation like? So we've heard reports about tuberculosis, resistance to antimalarials, resistance to sexually transmitted infections, diseases. And you see that if you look at our practice, how we use these drugs, and it's really the crux of my conversation this afternoon, Nigerian time, that we are part of the problem. We as, when I say we, I mean we as individuals, as each human, we are part of the problem. Yeah, there's the policy bits, there's the knowledge gap, there's the coordination bit, there's the fund, but it's just the same concept with regards to the climate change and the likes. We have a part to play. And if you don't take anything away from my conversation this evening, it will be about taking responsibility. The challenge is really with antimicrobial resistance is a practice challenge. It's misuse or abuse. It's either you're the one doing it or someone who has done it has come in contact with you. That's really the interesting factor about antimicrobial resistance. And so there was a global action plan on antimicrobial resistance in 2015. And so you see, from resistance to TB to antimalarial to gonorrhea and HIV. And then I said, you know what, guys, because these diseases that I've mentioned with things that went around, from TB, we have a TB program in Nigeria, we have a malaria program in Nigeria, HIV, NACA, so we see that most of these diseases I've mentioned are programs that are countrywide programs. So they said, if we're having resistance to these kind of things, we better start thinking of a global action plan. So it's that global action plan of 2015 that led to the most of all other national action plans, just to mention. And that's why you find out that most action plans are post 2015. So no one is actually left out with regards to antimicrobial resistance, and that's really what this geographical map is showing. So we see that across countries, they have unique problems. So unique problems will be that maybe the microorganisms that are prevalent in those areas, the resistance profile for different countries, vary, but we see that there are similar outcomes. The similar outcome is that when people take antimicrobials that are supposed to stop an infection or stop or kill a germ, those germs don't die, or the microorganisms are not killed because they have evolved or become resistant over time. We've had reports of death and diseases, and we see that there's this whole concern around antibiotic abuse versus expanding essential accesses. Currently, there are conversations around how do we develop more antimicrobials. So there's that conversation, and then there's also the conversation about how do we alter or change or address our current practices to prevent further deaths and diseases from resistance. So we see that Nigeria is not left out of it, and we've had interventions with regards to this, and this is Nigeria's antimicrobial use and resistance situation analysis that was done 2017 to sort of understand the situation of Nigeria, and the report highlighted this. And then you see the actions that we decided that we want to take. So the report highlights, you see those 6 points: the poor public awareness, poor One Health coordination, non-existence of a national AMR laboratory, non-existence of a national IPC coordinating body, and lack of an antimicrobial stewardship, and then 6 studies on health and economic impact. You see that I can tell you it's very proud that we've had some sort of actions and policies around 1, 2, 3, 4, and then 5 is underway, because stewardship thrives on IPC and policies and awareness. So stewardship is the other bit that is currently underway, and there's been a couple of institutional arrangements or considerations for that. We are very familiar with Nigeria. We have a 200 million population and the largest population in Africa compared to other countries within Africa. So there is a One Health strategic plan that also exists. So AMR is such that we also treat animals with antimicrobials. And I didn't want to dive too deep into what antimicrobial resistance is and whatnot, but one thing I always like to say is that antimicrobial resistance is in 2 parts. So the first part is if I misuse, or if I abuse, or if I'm wrongly diagnosed, or if I wrongly use an antimicrobial, I could become antimicrobial resistant. That's one. Another is that so it's about consumption. It's how I consume antimicrobial versus how I use it. So it's either I do it intentionally, or someone administers it to me, or I consume an animal that it's been administered to wrongly. So, or it's in my environment. And there are a couple of studies that we have done around this in the human health, in animal health, in the environment. For the environment, we've had metagenomic surveillance systems. There's a global sewage project that is taking samples of environmental samples of sewers or fluids, and they analyze, and we see that, oh, we have antimicrobial resistance in the environment. In animals, there's certain, like poultry or beef, or if you administer antimicrobials to them, there's what they call the period of when you keep them before you slaughter them. Some of these things are part of the problem start. So it's not just about not taking your antimicrobials properly, it's about how you consume it in your environment. So a One Health strategic plan was looked into, and this is from 2019 to 2023. So this is what the steering committee really looks like. If you remember the problems that I mentioned here, you see that we said there was no One Health coordination. So this has been addressed through this One Health. There's a One Health AMR steering committee, and the NCDC is the secretariat, and it has these pillars. There's an awareness pillar, AMR research, AMR surveillance, 5 pillars, and this is how we work. We work with other agencies. There's the NCDC bit, which handles the the infection prevention control, the antimicrobial stewardship, the surveillance and advocacy, and then coordination. And then other organizations have the role they play. So currently, this is the antimicrobial action plan. It's from 2017 to 2022. These documents are all on the NCDC website. So if you go to www.ncdc.gov.ng, you would see, if you go to guidelines or guidelines and documents, you will find these documents there. So also we have the National Action Plan for Health Security. You'd get to learn that, or if you don't already know that, you have the international health regulations, and then you have the global health security agenda, and then you have One Health. So all these things have different conversations, but they're all geared towards the same thing. So if you look at the National Action Plan for Health Security, you see that there's One Health, and then you have all the other factors within, and then you have a National Action Plan for Health Security, and then you have the country capacity. So we've done joint external evaluations, and you will see that in a bit. We also have a guideline for antimicrobial resistance laboratory surveillance. If you also look back, you will see that it was identified that there is no laboratory. Damilola, please let me know when I'm running. Oh, I think I've overshot the time. Right? We're late on time. So let me just wrap this up. And there is an international health regulation implementation in Nigerian law. So then there's this joint external evaluation that I mentioned. So these activities happen every year. There's the National AMR coordinating body meets within the year and have planning meetings and workshops. For glass, we have the 2022 glasses out, and there's a visualization dashboard on the WHO website. I will drop some of these links in the chat, and there you would see how Nigeria, because we submit, it's not every country currently that is submitting to glass, but this is just to tell you, if you're not sure or certain, oh, where's the AMR reported in Nigeria for at the moment globally? Yeah, it's reported at glass, and currently works are underway to see how this can be done more, because currently this happens once in a year. And then these are points where, as young people, we can start engaging the conversations. There is the World Antimicrobial Awareness Week that happens in November. So you see that every November, the week of the 12th or the week of the 17th, it's normally the second week. I know we normally wrap it up in the 28th, but the November is the World Antimicrobial. There's a week dedicated for this in November. Often you have it start from the 12th to the 17th, but it's a week-long program, right? And these are, so, but the conversation I normally say is, let's not wait till November to start engaging the conversation. Currently, I mentored about a couple of, maybe a group of 6 drummed from different parts of Africa that had different assignments they had to do on antimicrobial resistance, and these opportunities are there, and this is how we can start engaging the conversation. I think the first thing we want to do is we want to find out, what do people even, do you know what antimicrobial resistance is, and how does it affect your daily life? I think that in itself alone, helps to fuel the conversation really about what we can do. Institutionally, I'm a benefactor of this fellowship, and they are fund, although this fellowship is within these organizations that are in the Ministry of Health. So there's a new policy fellowship now, and the professional fellowship has two cohorts. We are the first cohort, and I think the second cohort is currently on. And for the regional grants, they are whole genome sequencing, planning, policy, and advocacy, common protocol, data collection, and the likes. I'll just run through this to show just a few points that I've highlighted that we could actually take points on. So really, it's about taking responsibility. We must become the change agents we want to see. This is what I do. So when I get into any pharmacy or something to pick a drug, and sometimes I just try to request for an antibiotic, I just say, oh, please, I need one capsule of Ampiclox. If the pharmacist or whoever doesn't question or query or try to correct me about trying to take just buying one capsule, I start to engage them. If people come, is this how you let them? And I try to do it in a way that they don't feel bad or become resentful. So it's also about learning how to communicate behavioral change. And this starts with having some sort of education and awareness, different campaigns. Now we have social media. Nobody's stopping you from owning a YouTube channel that talks about antimicrobial resistance, advocacy, and also engaging really. We should engage local government representatives. We normally think that they are so high up there, but there are quick wins that we can do. Say, oh, antimicrobial, you can go up to Glass, check up what the data set looks like for the country and say, that people are dying from just this kind of drugs. That can we have this community dialogue on use of antimicrobials? I used to live in Lagos, and there's this common these people that sell drugs in buses, one cure drugs. Some of those drugs actually have antimicrobials mixed, all sorts of concoction of antimicrobials, painkillers, and they tell you that, oh, if you just take this, it would cure everything, and you see that we start approaching, and then research and innovation. I'll stop here. I think I've overshot the time.